This video, welcome on this channel. I'm Dr. Raissa Kaneza, a medical doctor working as a general practitioner at Centre de lutte contre le diabète, which is the biggest center that takes care of diabetic people within Burundi. So today's topic is going to be held on, as you see, the distal symmetrical polyneuropathy, or DSPN. And as my English speaking skills are not at their maximum, I choose to share with you a PowerPoint presentation on this topic so that you can by yourself read what I'll be saying, as my accent is not really exceptional. So we are going to, this is a quick plan, a short plan of the presentation. We are going to introduce the subject, and we will, with a figure picture, we will have a quick overview of different diabetic neuropathies. But as I've said it before, the today's topic will be the distal symmetric polyneuropathy, or DSPN. And of course, we are going to conclude by key messages to keep in mind as health professionals. You all know that diabetes is a major public health problem affecting people worldwide, but especially in the low and middle income countries. And you all know that if not well treated, the condition leads to invalidating or life-threatening complications. And the today topic is the most common complication of diabetes, which is a distal symmetrical polyneuropathy. This is a figure that shows the main component of diabetic neuropathy. As you can see, this figure shows a typical form of distal symmetric polyneuropathy, this one. And what to keep in mind before ongoing with this presentation. What we should keep in mind is the diagnosis of diabetic neuropathy is a diagnosis of exclusion. So we must exclude all other causes that can cause that condition, and then after we will keep the diagnosis of diabetic neuropathy. So this feature clinically the DSPN. This one is rather radiculoplexopathy, as you can see on the legend of this picture. The C figure, the image representing the C later, is for mononeuropathy or mononeuritis multiplex, and the figure represent autonomic neuropathy. As I said it before, you can see on the legend that there are some other conditions that can look like that component of diabetic neuropathy, but are not actually diabetic neuropathy. And we also have to keep in mind that there are other conditions of neuropathies, nerve injury that can occur within diabetes people, but that are not really or that are not necessarily diabetic neuropathy. So what is distal symmetric polyneuropathy? What does it consist of? As a health professional, we will have patients that come at our office saying that there's something prickling, itching, or sharp, even burning, and those symptoms will be most common, mostly located at distal, and they will be symmetrical, and they will occur with the maximum of intensity at night. At a neurologic point of view, symmetrical sensory, there will be a symmetrical sensory loss in the feet or above the ankles, and the ankles and artery reflexes will be either reduced or absent. And please, let's keep in mind that the diagnosis of diabetic neuropathy is a diagnosis of exclusion. And the differential diagnosis for this condition of DSPN is acute painful small fiber neuropathy. Well, of course, there are main risk factors that are associated to the condition. Many studies showed, of course, hyperglycemia, which is with both the duration and level of high blood pressure, dyslipidemia, alcohol and tobacco consumption, obesity. And as a health professional, we always ask ourselves if it is treatable, and if yes, how. Well, in this condition, we'd rather choose the term the term manageable, as we can only help the resolution of symptoms to occur after several months of adequate management. And there are three cornerstones of the management of this condition. Of course, there are glycemic control and the control of other cardiovascular risk like high blood pressure, dyslipidemia, lifestyle modification that would work on like alcohol and tobacco, and also obesity. These components have been shown to either delay or prevent the diabetic neuropathy within type 1 diabetes especially. The second cornerstone of the management of this condition is early and regular diagnosis with the diagnosis method, as 40% of DSPN may be asymptomatic. And the third management of the pain, the third cornerstone of management of the DSPN is the management of the pain associated with the DSPN. According to guidelines, we will be using other duloxetine, pregabalin, gabapentin, or even tricyclic antidepressants like amitriptyline. While concluding on this topic, what to keep in mind as a health professional is that distal symmetrical polyneuropathy is an invalidating and most common complication of diabetes, with several outcomes, that is diabetic foot that can lead to amputation. And the distal symmetric polyneuropathy, as all the other components of diabetic neuropathy, is a diagnosis of exclusion. And we also should keep in mind that better control of hyperglycemia near to normal glycemia, and the control of other cardiovascular risk can delay or prevent the DSPN or even all the other diabetic neuropathy. And most important, we should plan early and regular diagnosis, as 40% of DSPN are asymptomatic, and this will allow us to offer better care to our patients. So, dear viewers, and this is where our video ends. I hope this helped you better understand the conditions, and for further research, you can consult these references that I have been using to prepare this condition. Thank you very much. See you next time. Bye.